Welcome back. It's 8:42, and this Breast Cancer Awareness Month, many women and men need to know there is no one-size-fits-all when it comes to breast cancer screenings. Dr. Tara Bollinger is an oncologist at IU Health. Thank you for joining us this morning. So let's just jump right in. How often should people get a mammogram? I know it's age dependent, but what do people need to know about the timing of this?
Yeah, I mean, it really, like you said, is certainly not one size fits all. It's really personalized in terms of your family history and your other risk factors, your breast density, things like that. So, what I recommend in general is for women to start talking to their doctors by age 40 about when they should start and how often they personally should be getting mammograms.
And it's important to know, this is a disease that also affects men. So for our male viewers who are watching, or if someone has a loved one, what should men look out for since they don't, normally get those traditional yearly screenings like women do?
Right. So male breast cancer is rare, but it certainly happens and it gets missed a lot. So, yeah, we don't do screening mammograms for men, but men, it would still present very similarly. So, a lump, a bump, nipple changes, a place where your breast tissue is dimpling where it didn't used to, and really bringing that to the attention of a physician because then we still do ultrasounds and mammograms to take a closer look at that in a man.
One recent survey suggested more than a third of Americans missed scheduled cancer screenings this year due to COVID-19. We've talked about this before, but why is it so important to get these appointments in? There are COVID precautions in place at these centers. Why do you not want to miss this?
Right. So, I mean, I think in this time of uncertainty where we don't really know a lot about what's going on, I think it's really time for people to reprioritize their health and their cancer screenings. So, in terms of mammograms, we know that mammograms truly save lives. So, a cancer that we find on a mammogram is much more likely to be easier to treat and something we can cure than something we don't find until it becomes something that we can feel. So, it's so important to get in there early. And, like you said, we have a lot of precautions here and everywhere else to make sure that it's safe and comfortable to have this done.
And if you're just starting this process or even thinking about starting the process, where do you begin? Do you talk to your primary care doctor first? How do you go about saying, oh my gosh, how do I find an oncologist if you don't have any background in how to do that? What's the best way to find someone?
Yeah, so I think if there's just something that you're worried about or you want to talk about your risk, then making sure that you know your family history, both men and women, with potential breast disease, and then talking to a primary care doctor or an OBGYN. And sometimes patients who don't even have breast cancer need to see a breast specialist to talk about their risk. But if there is something in particular that you're worried about, or you do go into mammogram and you get diagnosed with a breast cancer, that waiting period is super scary. But usually there are coordinators and people to kind of hold your hands and get you in place with all the different specialists that you need to see. And it's just kind of one step at a time and waiting until you can get all that information, which is really tough.
All right, Dr. Tara Bollinger with IU Health, an oncologist with IU Health. Thank you so much. It's such an important topic. I know once people get in, it moves along pretty quickly. So thank you so much for joining us to talk about and why you should not wait. And for more information on breast cancer screenings, just head to fox59.com/links.